Lithium has been a central component in the treatment of bipolar disorders for decades. It is highly effective in preventing maniac and depressive episodes. It's used to make things like phones to airplane parts. One compound lithium is used in psychiatric medicine, most commonly to treat patients with bipolar disorder. It's astonishing how the exact element used in batteries would be good for your brain. We've been using this treatment for years and we're still seeking to understand how and why it works. Physicians began implementing lithium compounds to serve neurological conditions back in the mid-1800s. Subsequently, in 1949 Australian psychiatrist John Cade discovered that lithium carbonate in particular could treat extreme mood swings symptomatic of bipolar disorder. Throughout the extent of the following 70 years this compound went on to become a first-line treatment, a treatment that is accepted as best for the initial treatment of a condition or disease. Today, the World Health Organization views it as one of the world's most essential medicines.
Researchers roughly calculate that around 45 million people around the world have bipolar disorder. And while there are slightly different subtypes of bipolar, all this considered, this could be disruptive to everyday life, and on average it may shorten an individual life expectancy by 9 to 17 years.
So having a drug like lithium is extremely necessary, but regrettably it doesn't work for everyone. A 2017 study showed only 1/3 of patients could be treated with lithium alone. For everyone else, either doesn't work or has to be paired with another drug to get results. And for an extensive amount of time, we couldn't figure out why it worked at all. However, eventually we have began to put the pieces together. In the 1970s, researchers gradually disclosed that lithium can help balance. Magnesium plays an essential role in neurological health by helping electrical signals move from one neuron to another, and studies reveal that patients with bipolar disorders symptoms often have irregular levels of magnesium. So the fact that lithium can stabilize magnesium levels means it could improve how signals are transmitted through the nervous system, but that doesn't seem to be the only way it works. Like the author mentioned from the more recent 2018 study, while lithium may play nice magnesium, it gets competitive with sodium. Normally sodium binds with certain types of G-protein couple receptors or GPCRs, which are protein found on cell membranes that help activate cell responses. Humans have more than 1,000 types of GPCRs, and they help regulate everything from our sense of taste to the levels of serotonin and dopamine in our brain. And in this 2018 study, scientists found that lithium cancels out sodium. When lithium binds with compatible GPCRs instead of sodium, it can deactivate them. But that's actually a good thing. We're still figuring out a lot on how these receptors operate, but we do know they can be hyperactive with patients with bipolar disorder. Some GPCRs in our brain control levels of chemicals like serotonin and noradrenaline, which scientists believe are key players in bipolar disorders. So if lithium can activate some of the hyperactive receptors, that might be another reason it can treat symptoms so well. So overall there are still some things needed to be put down, but we're finally getting an understanding of why lithium works at all. And in 2017 another study came out that might shed some light on why lithium only helps in some cases. Researchers concentrate on mapping how lithium works on a molecular level.
With that, they discovered that bipolar disorder can be caused by a protein involved in nerve cell communication, called CRMP. CRMP activity is causally linked to BPD behavior. This matters for a couple of reasons.
First, by understanding how lithium interacts with its proteins, doctors can better predict which patients might respond well with the treatment, but also these results could that bipolar disorder isn't always caused by changes to someone's genetic code. It could also be the results of how proteins like CRMP2 are wired inside.